A pleasure to be here with Dr. Kunal Sarkar. Dr. Sarkar, welcome to the Kolkata Literature Festival. So you're here to deliver the Jeet Paul Memorial Lecture, which is in the context of COVID, in the context of how the healthcare system has adapted and evolved. So what would be the crux of your talk if you could just brief us?
Look, I think perhaps public memory is short, and public memory is even shorter when we recover from disasters. So perhaps time is almost here with us to take a brief stock of what kind of a beating we have taken for the last 2 years, not just healthcare, every person, society at large. Uh, we should have extracted more lessons from this experience than we did. I would definitely focus intently on the healthcare angle. And this experience, this turmoil, has it really left healthcare, the fundamentals of healthcare, in a more sort of firm foundations than what it was before? Perhaps, there isn't a tremendous scope to be laudatory or congratulatory in this speech. At times, probably it will be a bit critical. But I think we mustn't let this opportunity to go to take a hard look at ourselves. Because, look, healthcare has not really been top of the pops as far as government priority is concerned. And it's sad to see that a virus which arguably claimed more than 15-20 lakh victims in our country has also really not succeeded in pushing it much above in our list of national priorities.
So if you look at a more macro angle of healthcare in India, if you look at India on a macro scale, we are heading towards a situation where we increasingly have one India, one identity, one India, one ideology, one India, one kind of culture, one language. But why not one India, one healthcare? Why do we not have a nationally defined health policy yet? And how much of an obstruction is that when it comes to systemic challenges relating to healthcare?
Well, it's a tremendous obstruction because I think every few minutes, probably, if you eavesdrop in the healthcare circles, you will get to hear that we were wanting to move healthcare from it's in the state list. It's a state list where there are frequent interferences by the central government. And why is that so? But about 60% of the funding allocation in one way or the other comes from there. So they are paymasters who are controlling a significant part of the resources. But how do we formulate policies? How do we sort of systematize the healthcare delivery mechanism? A very fundamental confusion. You see, which way are we heading for? Are we going into a uniform, one dispenser socialistic system, or it's going to be a mixed bag, a mixed economy? You will have a mixture of the public and the private. Probably the latter is the truth, but this truth, is emerging more out of default rather than intention. We had expected that post the blast of COVID, that we would take this opportunity and sit down and iron out some of these policy deficits, some of these strategic deficits, and healthcare. In a similar line, it is pathologically centralized, all of which really crumbled during the second wave because it was, hell break loose all over the place. But once now we are back into a kind of status quo, we don't seem to have sort of absorbed the lessons. And are we expressing a national desire to get back to the drawing board and saying, look, these were our difficulties during the time of COVID. So let's start the structural process. It's very ironical that many of the very well articulated government policies, which had nothing to do with health, was a derivative of the COVID times, like the infamous farm laws, which has since attained martyrdom. Uh, and one more policy which always made me very curious was, if you ever, perhaps you will, I won't, if you ever wanted to venture out into the space as an Indian, space travel was privatized. Private presence in space travel was legitimized. So, we had all these things coming out of COVID policy. But in terms of policy making, resources, intentions, significant shift in our attitude and funding of healthcare, well, alas, we are back to the pre-COVID era.
What can we do to get healthcare more integrated into the political dialogue of the country? It never really seems to be an election issue. 2014 perhaps was the first time that healthcare received some sort of attention at the national level. So how can that improve?
Absolutely right. But it is once again surreptitiously, it is becoming a public dialogue now. But obviously, it doesn't compete with India, Pakistan. It doesn't compete with Hindu Muslim. It doesn't compete with scheduled caste, scheduled tribes. But probably, once I was playing around doing some mental maths. But I think healthcare is within the first 10. Uh, and because it's vote seeking. You look at West Bengal where we are sitting today, when our chief minister rolled out the dice in 2018 and said this state scheme was available to everyone. Great intentions, but very poorly resourced. But why did she do that? Because schemes like the state health scheme, schemes like the 500 rupees to the women in the states, Lokhir Bhandar and all that, these benefits are absolute, they are magnets as far as vote catching is concerned. So come what may, we will have our problems, government will have their problems, but West Bengal's very tenuous, very ill-resourced, but politically very formed intention on universal health care, partially dispensed, is going to stay.
I'm going to segue to talking about your book, The Sickness of Health, which has provided an excellent account of the great accomplishments that we've had in healthcare as well as the systemic challenges. Could we expect a second edition of that book or an updated edition? Because I believe the first one talks about the first wave of COVID. Maybe an updated one going into further details?
Well, I am working on it. I'm very guilty that being a committed cardiovascular plumber and post COVID, uh, we don't have the leisure of lockdown at the moment. So time is at a premium. I'm looking at two things. Obviously, I couldn't agree with you more. An updated version is required. I'll probably within the next 6 months I'll have it out, and I'm trying to work at a Bangla version. And in Bangla version, probably, if I could, know of someone, I would be very willing to collaborate. I was wanting to do a comparison about the healthcare of the two Bengals, us and Bangladesh, at this point of time, because I think that will form a very interesting study.
My final question is that if we look at doctors in the way they are coming into the public sphere more, especially through your conversations, through your dialogue, but do you feel that enough of academic contributions are coming from the healthcare sector? Doctors are doing enough in terms of academic insights with respect to Indian doctors talking about Indian healthcare, Indian medicine in the academic forums?
I think the short answer will be no. The reason the short answer is no is because you see, doctors have enough trouble to cope with in their day to day life. And what happens is, as far as their day's work is done, they are extremely happy. The bar of contention is set very low. Secondly, is it's an ongoing rigmarole. Medicine is a very unstructured profession. There is no 9 to 5. There is no sort of systematic or whatever working environment or structure to this. And doctors who are like in private practice, independent consultants, whether in government or in the state, I tell you, pardon me for saying so, they have the poorest understanding of healthcare delivery. Their understanding of healthcare delivery is my day's work getting done. I'm paid my fees. I'm looking after my patients. Period. The rest of the healthcare environment, policy, etc., could go to hell. I don't blame them because even accomplishing that bit is a tough challenge. Lastly, you see the other problem we grapple with endlessly is we have n number of healthcare associations. We have the IMA, we have the regional bodies, we have in government hospitals, we have all these various doctors' groups, etc. But there, the biggest pollutant is politics because each one of them is so politically committed. You know, the Trinamool Doctors Forum is more Trinamool than Mamata Banerjee herself, right? So their politics predominates so malignantly that the true issue, sometimes they need to have cross conversation to have the courage of conviction, genuinely resolve the problems in government healthcare, in private healthcare. And that forum is woefully lacking because we are either indifferent or we have an excess of political leaning and commitment. So the biggest casualty in this whole process is taking an impartial look at healthcare. We've had some of our profession leaders who've time and again come out and articulated great ideas, great facets of healthcare delivery. But eventually, most of them, good for us, good for the profession, they took on the mantle of being big healthcare entrepreneurs. And thereafter, the balance sheet predominated over the conscience.
Finally, and this is going to circle back to where we started with the interview, what do you think it will take for India to have its moment of reckoning when it comes to healthcare? We've seen countries like Japan and Germany have it in the 20th century. Britain had it at a time when it was arguably in a nadir, given the late 1940s. But what will it take, if not COVID, for India to have a similar reckoning?
You see, I hope I'm wrong, but my belief so far is that India will end up being a United States born out of confusion. Like United States, you will have 30% of the population who still have no health care. Right. You have the other 70% who has an entire spectrum from, sort of low cost, middle cost, high cost. So it'll be a very market dictated procedure. Equivalent to what you have in the United States, like the Veterans Program, some of these Medicare, etc., which look after the have nots. It's good to see that we are having at least such programs like Ayushman, state schemes, Shastra Shati in Bengal, who's getting their share of criticism. But I think the biggest solace at this point of time is that you see from the so-called middle class segment to upwards, it will be very confusing. It will be a kind of free for all, a very market commoditized healthcare. But for the lower 30%, there is at least some comfort, some blanket, because this is what fetching the votes. This is tracking it back to political populism. I'm not interested in that. I'm interested is at least somebody who still earns 10,000 rupees a month is today able to have an orthopedic operation, a heart operation, a brain operations, something that could easily set them back by 6-7 months.
Thank you so much for your insights, sir. Have a great time at
All the
Care.
best. Be well. Thank you.